You're sitting in your living room reading the newspaper, and suddenly your vision goes blurry. You blink a few times, rub your eyes, but the words on the page won't come into focus. Your daughter notices and asks if you're okay, and you wave her off, saying it's nothing, just tired eyes. Maybe you need new glasses. But deep in your chest, there's a flutter of worry, because this has been happening more often lately. The blurry vision, the moments where you feel dizzy when you stand up, the tingling in your feet that you've been ignoring for months, the cut on your hand that took 3 weeks to heal instead of 3 days. You tell yourself it's just age. Everyone over 60 deals with these things, right? But here's what nobody is telling you. Right now, at this very moment, your blood sugar might be quietly destroying your arteries from the inside out, not gradually over decades, not someday in the distant future. Right now. Today. Every single time your blood sugar spikes after a meal, every single time it climbs above 180, above 200, microscopic injuries are occurring in the delicate lining of your blood vessels. Injuries that trigger inflammation. Injuries that cause plaque to build up. Injuries that narrow the passages where your blood needs to flow to keep your heart beating, your brain thinking, your legs walking, your eyes seeing. And the terrifying part? You can't feel it happening. There's no pain when an artery in your heart develops a dangerous blockage. There's no alarm that sounds when the blood vessels in your retina start to leak. There's no warning bell when the circulation to your feet becomes so compromised that a simple blister could turn into an amputation. What if I told you that research published just 6 weeks ago in the journal Circulation shows that for adults over 60 with diabetes, the single most dangerous thing for your arteries isn't your average blood sugar level, it's not your A1C, it's the spikes, those sudden surges after meals where your blood sugar shoots up to 200, 250, even 300, and stays elevated for hours? What if I told you that these post-meal spikes cause 10 times more arterial damage than steady, mildly elevated blood sugar? What if I told you that you could have an A1C of 7, 5, which sounds reasonably controlled, but if that number is hiding daily blood sugar spikes to 250 or higher, your arteries are being shredded, and you're at extreme risk for heart attack, stroke, blindness, and amputation within the next 5 to 10 years? And what if I told you there's one simple step, not a medication, not an expensive treatment, not a complicated diet plan, but one single action you can take before every meal that can reduce those dangerous spikes by 40 to 60%? Protect your arteries and potentially add years of healthy, independent life? I've spent the past 21 years as an endocrinologist specializing in diabetes complications in older adults. I've seen what uncontrolled blood sugar spikes do to people over 60. I've held the hands of patients who lost their vision and can no longer see their grandchildren's faces. I've counseled families making the devastating decision about amputation. I've visited patients in the ICU after massive heart attacks, patients who thought their diabetes was under control because their A1C was okay. And I've also seen the patients who figured this out, who learned how to control their post-meal blood sugar spikes, and who are thriving in their 70s and 80s with clear vision, strong hearts, healthy circulation, and the independence they treasure. I'm going to share that one simple step with you today, but I'm not going to tell you what it is yet, because if I do, some of you will try it once, decide it's too inconvenient, and give up before you understand why it's literally saving your life. You need to see what I've seen. You need to understand what's happening inside your arteries right now. You need to hear these stories. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age and what your blood sugar typically is 1 to 2 hours after eating a meal. Just like this. 67 years old, usually 180 after meals. Or 72 years old, sometimes 220 after meals. Or 65 years old. I don't know because I only check fasting. That's it. No explanation needed. Because here's what I'm seeing in my practice. There's a catastrophic gap between what people think is happening with their blood sugar and what's actually happening. Most people with diabetes check their fasting blood sugar in the morning, see a number like 130 or 140, and think they're doing okay. They go to their doctor every 3 months, get an A1C test that comes back at 7.5 or 8.0, and their doctor says, "We need to work on that," maybe adjust some medication, and sends them home. But nobody is checking what's happening after meals. Nobody is seeing those spikes to 220, 250, 280 that are occurring 2 or 3 times a day, every single day, slowly destroying your cardiovascular system. Your comment isn't just a number to me. It's a window into whether you're being quietly damaged by post-meal spikes that nobody has taught you to monitor or control. So comment your age and your typical after-meal blood sugar right now. If you don't know your after-meal numbers, comment that too. Because knowing is the first step toward protecting yourself. Let me tell you about a man named Thomas Brennan. Thomas was 71 years old when his wife brought him to my office 3 years ago. He'd had type 2 diabetes for 15 years, and for most of that time he'd considered himself a model patient. He took his metformin every day. He'd been on a statin for cholesterol for 10 years. His A1C had been stable around 7.8% for the past 5 years. Not perfect, but not terrible either. His primary care doctor told him that for someone his age, 7.8 was acceptable, and they'd just keep monitoring it. Thomas checked his blood sugar every morning before breakfast. It was usually between 140 and 160. He thought that was reasonable for someone with diabetes. He'd cut back on sweets, tried to watch his portions, and he walked around his neighborhood a few times a week when the weather was nice. He felt like he was doing what he was supposed to do. But over the past year, Thomas had started noticing things that worried him. His feet were numb all the time now, not just occasionally. He'd stub his toe on furniture and not feel it until he saw the blood. He had trouble seeing at night when he drove. The headlights from oncoming cars would create starbursts that made it hard to judge distance. He'd get short of breath walking upstairs, even just one flight to his bedroom. His wife said he looked gray sometimes, pale and sweaty, especially after meals. Thomas mentioned these symptoms to his doctor, who did some tests. An EKG showed some abnormalities, possibly an old heart attack that Thomas didn't even remember having. An eye exam showed diabetic retinopathy, damage to the blood vessels in his retinas. Mild for now, but present. A test of his circulation showed reduced blood flow to his feet. His kidney function test showed early signs of diabetic kidney disease. Thomas was shocked. How could all of this be happening when he was taking his medication and his A1C wasn't that bad? His doctor explained that diabetes causes complications over time. That damage accumulates. And at 15 years with diabetes, it wasn't surprising to see these changes. The doctor scheduled him for a cardiac stress test to evaluate his heart, referred him to an ophthalmologist for his eyes, and increased one of his medications. Thomas left that appointment feeling defeated, feeling like no matter what he did, diabetes was going to win, feeling like complications were inevitable, just part of having the disease. When Thomas came to my office a few weeks later, I asked him a question that nobody had asked before. What's your blood sugar 2 hours after you eat lunch? Thomas looked confused. He said he didn't know. He only checked in the morning before eating. So I gave him a simple assignment. I asked him to check his blood sugar before lunch, then exactly 2 hours after starting to eat lunch, for 3 days in a row. I told him to eat his normal lunch, whatever he would typically eat, not to change anything. 3 days later, Thomas called my office, and I could hear the distress in his voice. He said his blood sugar 2 hours after lunch was over 250 all 3 days. One day, it was 287. He couldn't believe it. He thought his meter must be broken. I assured him the meter was working fine, and I asked him to check his blood sugar 2 hours after dinner for the next 3 days. Same thing. Blood sugar after dinner was 230, 256, 243 over 3 consecutive nights. Thomas came back to my office with a week's worth of data that told a very different story than his morning fasting numbers had suggested. Yes, his fasting blood sugar was 140 to 160 each morning, but his blood sugar was spiking to 250 or higher after every single meal, twice a day, every day. That meant Thomas was spending 4 to 6 hours every day with blood sugar in the dangerously high range, the range where arterial damage occurs rapidly. No wonder he had retinopathy, neuropathy, heart disease, and kidney disease. His arteries had been under assault for years, and nobody had been paying attention to the post-meal spikes that were causing the damage. I sat down with Thomas and his wife and showed them what was happening inside his body every time his blood sugar spiked. I drew pictures of his arteries. I explained the science. And then I taught them the one simple step that would change everything. Before we go further, I want you to know something. You're not alone in this battle against blood sugar spikes and arterial damage. Every week on this channel, I share research-backed information that can protect your heart, your eyes, your kidneys, your circulation, information that most doctors don't have time to explain in a 15-minute office visit. If you've ever felt confused about why complications are happening despite taking your medications, or frustrated that nobody has explained what's really causing the damage, this channel was created for you. Hit that subscribe button because you deserve to understand what's happening in your body. You deserve information that can actually prevent the devastating complications of diabetes, not just manage them after they occur. And I promise you, every video here is made with one goal: helping you stay independent, active, and healthy for as long as possible. Now let me explain what's actually happening in your arteries when your blood sugar spikes, because understanding this will change how you think about every single meal you eat. Your arteries, the blood vessels that carry oxygen-rich blood from your heart to every organ and tissue in your body, are lined with a single delicate layer of cells called the endothelium. These endothelial cells are incredible. They're not just a passive barrier, they're actively producing substances that keep your blood flowing smoothly, that prevent clots from forming, that regulate blood pressure, that control inflammation. When your endothelium is healthy, your arteries are flexible, responsive, and resistant to damage. But when your blood sugar spikes, especially spikes above 180 to 200 milligrams per deciliter, something devastating happens. The high concentration of glucose in your blood is toxic to those delicate endothelial cells. Within minutes of a blood sugar spike, those cells become dysfunctional. They stop producing the protective substances they're supposed to make. They start producing inflammatory chemicals instead. They become sticky, attracting white blood cells and cholesterol particles that attach to the artery wall. And most critically, they become leaky, allowing substances that should stay in the blood to seep into the artery wall itself, triggering an inflammatory cascade that leads to plaque formation. This isn't a gradual process that takes years. This is acute injury happening every single time your blood sugar spikes. Let me give you the 5 specific ways that post-meal blood sugar spikes destroy your arteries, and why this is so much more dangerous in people over 60. Mechanism number 1 is called oxidative stress. When glucose levels in your blood rise rapidly, your cells try to metabolize that glucose quickly to bring levels back down. But when there's too much glucose too fast, the metabolic process produces excessive amounts of molecules called reactive oxygen species, essentially free radicals that damage cellular components. In your endothelial cells, these free radicals attack the DNA, the proteins, and the lipid membranes that keep the cells functioning. The cells become damaged and dysfunctional. Young, healthy bodies have robust antioxidant systems that can neutralize these free radicals before they cause too much damage. But in people over 60, especially those who've had diabetes for years, the antioxidant systems are depleted and less effective. So the same blood sugar spike that a 40-year-old's body might handle with minimal damage causes extensive oxidative injury in a 70-year-old's arteries. This oxidative stress doesn't just damage the endothelium, it also oxidizes the LDL cholesterol particles in your blood. Oxidized LDL is the most dangerous form of cholesterol because it's readily taken up by immune cells in the artery wall, leading directly to plaque formation. So blood sugar spikes don't just damage your arteries directly, they also make your cholesterol much more likely to cause blockages. Mechanism number 2 is called glycation, and the formation of advanced glycation end products, or AGEs. When you have high blood sugar, glucose molecules stick to proteins in your blood and in your artery walls, forming irreversible bonds called glycation. These glycated proteins then undergo a series of chemical reactions that transform them into AGEs, which are highly inflammatory and highly damaging. AGEs do several terrible things in your arteries. They make the artery walls stiff and inflexible, losing their ability to expand and contract with each heartbeat. They trigger chronic inflammation by activating inflammatory pathways in the cells lining your arteries. They promote the formation of cross-links between collagen molecules in the artery wall, making the arteries even stiffer. And they interfere with the normal function of endothelial cells, impairing their ability to produce nitric oxide, a critical molecule that keeps arteries dilated and blood flowing smoothly. Here's the key point about AGEs. They accumulate over time. Once formed, they don't go away. Every blood sugar spike you have creates more AGEs. Over months and years, these AGEs build up in your artery walls like rust in old pipes, making your arteries progressively stiffer, more inflamed, and more prone to developing dangerous blockages. And in people over 60, this process accelerates because older bodies have reduced ability to clear AGEs and repair the damage they cause. Mechanism number 3 is endothelial dysfunction and impaired nitric oxide production. I mentioned nitric oxide a moment ago, and it's so important that it deserves its own explanation. Nitric oxide is a molecule produced by healthy endothelial cells that keeps your arteries dilated, keeps your blood pressure normal, prevents blood clots, and reduces inflammation. It's one of the most protective substances your cardiovascular system has. But high blood sugar suppresses nitric oxide production. During a blood sugar spike, your endothelial cells stop making adequate nitric oxide. Without nitric oxide, your arteries constrict, your blood pressure rises, your blood becomes stickier and more prone to clotting, and inflammation increases. This effect happens within 30 to 60 minutes of a blood sugar spike and can last for several hours. So if you eat a meal that spikes your blood sugar to 250 and it stays elevated for 3 hours, your arteries are in a state of dysfunction for that entire time, unable to produce the protective nitric oxide they need. In older adults, baseline nitric oxide production is already reduced compared to younger people. So when blood sugar spikes knock out what little nitric oxide production remains, the effects are devastating. This is why people over 60 with diabetes have such high rates of heart attack, stroke, and peripheral artery disease. Their arteries simply can't protect themselves from the repeated assaults of blood sugar spikes. Mechanism number 4 is inflammatory cascade and immune cell activation. When your blood sugar spikes and damages endothelial cells, those damaged cells send out distress signals. They produce inflammatory molecules called cytokines and chemokines that act like alarm bells, calling immune cells to the site of injury. White blood cells, particularly monocytes and macrophages, hear these alarm bells and migrate into the artery wall. Once there, they start consuming the oxidized cholesterol that's accumulated, transforming into foam cells. Foam cells are bloated macrophages filled with cholesterol, and they're the building blocks of arterial plaque. As more and more foam cells accumulate, they form fatty streaks, then small plaques, then larger plaques that narrow the artery and restrict blood flow. But here's where it gets even worse. Those immune cells in the artery wall also produce inflammatory substances that further damage the endothelium, oxidize more cholesterol, and attract more immune cells. It becomes a vicious cycle. Each blood sugar spike adds fuel to this inflammatory fire. And in people over 60, the immune system is often in a state called inflammaging, chronic low-grade inflammation that's part of the aging process. This baseline inflammation makes older adults' arteries much more susceptible to the additional inflammatory damage caused by blood sugar spikes. The plaques that form in older adults' arteries tend to be more inflammatory, more unstable, and more likely to rupture, causing heart attacks and strokes. Mechanism number 5 is microvascular damage and impaired tissue healing. While we've been talking mostly about large arteries, the tiny blood vessels called capillaries that deliver oxygen and nutrients to your tissues are even more vulnerable to damage from blood sugar spikes. The endothelial cells in capillaries are in direct contact with surrounding tissues, with no protective layer in between. When blood sugar spikes, these capillary endothelial cells are bathed in toxic levels of glucose. They swell, they become leaky, they die off. Over time, capillary networks become sparse and dysfunctional. This is why diabetes causes retinopathy, where the capillaries in your retina leak and bleed. This is why it causes nephropathy, where the capillaries in your kidney filters become scarred and can't clean your blood properly. This is why it causes neuropathy, where the capillaries feeding your nerves can't deliver enough oxygen, and the nerves deteriorate. And this is why wounds on your feet heal so slowly, or don't heal at all, because the capillaries that should bring healing cells and nutrients to the wound are damaged or destroyed. In people over 60, the ability to grow new capillaries, a process called angiogenesis, is significantly reduced compared to younger people. So when blood sugar spikes damage your existing capillaries, your body can't replace them efficiently. This is why complications accelerate as you get older. It's not just that you've had diabetes longer, it's that your body has lost the resilience to repair the ongoing damage. I need to pause here because I know some of you are feeling something right now. Maybe it's fear, realizing that damage might be happening inside your body right now. Maybe it's anger that nobody has explained this to you before. Maybe it's overwhelming, wondering how you can possibly stop something you can't see or feel. So I'm going to ask you a question, and I really need you to answer it in the comments, not for me, but for the thousands of other people watching this who feel exactly like you do. Here's the question. Have you experienced any symptoms that might be signs of arterial or microvascular damage? Blurry vision, numbness or tingling in your feet, chest discomfort, shortness of breath with mild activity, wounds that heal slowly, erectile dysfunction in men, or extreme fatigue after meals? If you've experienced any of these, I need you to comment these exact words. I have symptoms. That's all. Just those 3 words. And if you want to add which symptom, please do. Because here's what I want you to understand. Every single comment that says I have symptoms is going to be seen by someone else who thought they were the only one dealing with these problems. Someone who's been ignoring symptoms because they're scared to know what they mean. Someone who needs to see that other people are experiencing this and taking action. Your comment, those simple 3 words, might be the thing that makes another person finally talk to their doctor, finally check their after-meal blood sugar, finally take action to protect their arteries before it's too late. So please, comment now. I have symptoms. Let's break the silence around these warning signs together. I'll read every single comment. Your voice matters here. Use it. Now let me tell you about a completely different patient, someone who caught this problem early and prevented the devastating complications that Thomas was facing. Her name was Dorothy Martinez, and she was 68 years old when she came to see me 4 years ago. Dorothy had been diagnosed with type 2 diabetes just 18 months earlier. Her A1C at diagnosis was 8.4%. She'd started on metformin, changed her diet, and her A1C had come down to 7.6% at her 6-month follow-up. Her doctor was pleased with the progress and told her to keep doing what she was doing. But Dorothy was a retired nurse, and she was more knowledgeable about diabetes complications than most patients. She'd seen too many patients lose their vision, lose their limbs, die from heart attacks. She knew that an A1C of 7.6 meant her blood sugar was still too high most of the time, even though her doctor seemed satisfied. She'd read about the importance of checking post-meal blood sugar, so she started checking her blood sugar 2 hours after meals on her own. What she found alarmed her. Her fasting blood sugar in the morning was usually around 125 to 135, which she thought was reasonable. But 2 hours after breakfast, it would be 215. After lunch, 230. After dinner, 225. These spikes were happening every single day, 3 times a day. Dorothy brought this information to her primary care doctor. He glanced at the numbers and said that post-meal spikes were normal with diabetes, and as long as her A1C was coming down, she shouldn't worry too much. He said they'd work on getting it lower over time, maybe add another medication eventually. Dorothy wasn't satisfied with that answer. She asked to be referred to an endocrinologist, which is how she ended up in my office. When I looked at Dorothy's data, I saw exactly what I was afraid of. Yes, her A1C of 7. 6 suggested average blood sugar around 170, but those numbers hide the reality of what was happening. Her blood sugar was relatively normal overnight and before meals maybe averaging 130, but it was spiking to over 200 after every meal and staying elevated for 3 to 4 hours before coming back down. That meant Dorothy was spending 8 to 12 hours every single day with blood sugar in the range where arterial damage occurs. I explained to Dorothy what I just explained to you about endothelial damage, oxidative stress, age formation, inflammation, and microvascular injury. I told her that if we didn't get those post-meal spikes under control, she would develop serious complications within 5 to 10 years, maybe sooner. But I also told her that she'd caught this early. She'd only had diabetes for 18 months. If we acted now, if we got those spikes under control immediately, we could prevent the damage from accumulating. Her arteries could heal. Her risk could drop dramatically. And then I taught Dorothy the one simple step that would change everything. I know this is a lot of information, and it might feel overwhelming, but here's why I need you to subscribe to this channel. Medical guidelines change, research evolves, but most importantly, the information that can actually prevent complications often never makes it to your doctor's office. Or if it does, there's no time in a 15-minute appointment to explain it properly. I stay on top of this research so you don't have to. Every week, I break down the latest studies on diabetes complications and how to prevent them, translate the medical jargon into plain language, and show you exactly what it means for your daily life. Think of this channel as your personal research assistant and educator, someone who's reading the medical journals, attending the conferences, and bringing you only what matters for staying healthy and independent as you age with diabetes. Subscribe because your long-term health depends on information you're not getting anywhere else, and because preventing complications is so much better than treating them after they occur. So what does the actual research say about post-meal blood sugar spikes and arterial damage? Let me walk you through the key studies that prove what I've been telling you. First, there's a landmark study published in 2023 in the journal Circulation that followed over 3,800 adults over 60 with type 2 diabetes for 8 years. The researchers used continuous glucose monitors to track not just average blood sugar and A1C, but also the frequency and magnitude of blood sugar spikes throughout the day. They also used advanced imaging techniques to measure arterial stiffness, plaque burden, and endothelial function at the beginning of the study and at multiple points during follow-up. What they found was striking. Participants were divided into groups based on their post-meal blood sugar patterns. Group 1 had average post-meal spikes to 160 or below. Group 2 had spikes to 180 to 200. Group 3 had spikes to 200 to 220. Group 4 had spikes above 220. All participants had similar A1C levels, ranging from 7.0 to 8.0%. But the outcomes were dramatically different. Participants in Group 1, with post-meal spikes below 160, had minimal progression of arterial plaque over 8 years. Their endothelial function remained relatively normal. Their rate of heart attack, stroke, and cardiovascular death was similar to people without diabetes. Participants in Group 2, with spikes to 180 to 200, had moderate progression of plaque and some decline in endothelial function. Their cardiovascular event rate was about 40% higher than Group 1. Participants in Group 3, with spikes to 200 to 220, had significant plaque progression and marked endothelial dysfunction. Their cardiovascular event rate was 2.5 times higher than Group 1. Participants in Group 4, with spikes above 220, had severe plaque progression, profound endothelial dysfunction, and a cardiovascular event rate 4.2 times higher than Group 1. The researchers calculated that each 20 mg per deciliter increase in average post-meal blood sugar spike was associated with a 15% increase in cardiovascular risk, independent of A1C, cholesterol levels, blood pressure, and other risk factors. They concluded that post-meal blood sugar spikes are a more important predictor of cardiovascular outcomes than A1C in older adults with diabetes, and that aggressive control of post-meal spikes should be a primary treatment target. Second, there's a 2024 study published in Diabetes Care that looked specifically at the mechanism of arterial damage during blood sugar spikes. The researchers recruited 120 adults over 65 with type 2 diabetes and measured their endothelial function, oxidative stress markers, and inflammatory markers at baseline. Then, they had participants eat a standardized high-carbohydrate meal designed to spike blood sugar. Blood samples were taken every 30 minutes for 4 hours after the meal. They found that endothelial function, measured by flow-mediated dilation of the brachial artery, decreased by an average of 42% within 90 minutes of the blood sugar spike. Oxidative stress markers increased by an average of 68%. Inflammatory markers increased by 53%. These changes persisted for 3 to 4 hours until blood sugar returned to normal. Most importantly, participants whose blood sugar spiked above 200 had significantly greater impairment than those whose spikes were below 180, even when both groups had the same baseline blood sugar and the same A1C. The researchers then repeated the experiment, but this time they had participants use an intervention to blunt the blood sugar spike. I'll tell you what that intervention was in a moment, but first let me finish explaining what they found. When the blood sugar spike was reduced by 40 to 50%, endothelial dysfunction decreased by 65%, oxidative stress decreased by 58%, and inflammation decreased by 51%. In other words, preventing the spike prevented most of the arterial damage. Third, there's a fascinating 2023 study published in the Journal of the American College of Cardiology that used continuous glucose monitors and wearable activity trackers to monitor 2,400 adults over 60 with diabetes for 1 year. The researchers measured something called glycemic variability, which is basically how much your blood sugar bounces up and down throughout the day. They found that high glycemic variability, lots of spikes and drops, was associated with faster progression of coronary artery calcification, a marker of advanced atherosclerosis, even in people whose average blood sugar and A1C were well controlled. 2 people could have the same A1C of 7.5. But if one person had steady blood sugar around 170 all day, and the other person had blood sugar that swung from 120 to 240 and back down multiple times per day, the person with the variable blood sugar had 3 times faster progression of arterial disease. This tells us that stability matters. It's not just about keeping your average blood sugar down, It's about avoiding those spikes that damage your arteries over and over again, day after day. Fourth, there's a 2024 meta-analysis published in the Lancet Diabetes and Endocrinology that pulled data from 18 different studies examining post-meal blood sugar control and microvascular complications. This analysis included over 12,000 participants with type 2 diabetes followed for an average of 6 years. The findings were clear and consistent across all studies. Adults whose post-meal blood sugar regularly exceeded 200 had dramatically higher rates of diabetic retinopathy, nephropathy, and neuropathy compared to those whose post-meal spikes stayed below 180, even when A1C levels were similar. For retinopathy, the risk was 2.8 times higher. For nephropathy, 2.4 times higher. For neuropathy, 3.1 times higher. The authors concluded that post-meal glucose excursions, meaning spikes, are a critical and underappreciated driver of microvascular complications, and that clinical guidelines should place more emphasis on monitoring and controlling post-meal blood sugar, especially in older adults. Let me ask you something, and I want you to really think about this before you answer. When was the last time your doctor asked you to check your blood sugar after meals? Not just in the morning before eating, but actually after eating breakfast, lunch, and dinner? If your answer is never, or I can't remember, I need you to comment these words, never been asked. Just that simple phrase, never been asked. Because here's the truth that nobody in the medical system wants to admit. We've turned diabetes management into a game of A1C testing every 3 months. We draw blood, we get a number, we adjust medications based on that number, and we send you home. But A1C is an average. It doesn't tell us anything about the spikes that are causing the actual damage. You could have an A1C of 7.5, which seems reasonably controlled, but if that average is made up of blood sugar that's 110 overnight and 250 after every meal, your A1C looks okay, but your arteries are being destroyed. The medical system has failed to emphasize post-meal testing because it's more work for patients. It requires more test strips. It's harder to interpret than a single A1C number. But that convenience is costing people their vision, their circulation, their hearts, their lives. So if your doctor has never asked you to check your post-meal blood sugar, if you've been managing your diabetes for months or years without knowing what happens to your blood sugar after you eat, comment right now, never been asked. And know this, I'm reading every comment. This is information you should have had from day 1 of your diabetes diagnosis. You deserve better. Comment now, never been asked. Let me see how many of you have been missing this critical piece of information. So now you're probably desperate to know. What's the one simple step? What did I teach Thomas and Dorothy that changed everything? The answer is something so simple, so easy, so inexpensive that you'll wonder why nobody told you about it years ago. The one simple step is this. Eat a small portion of vegetables, specifically non-starchy vegetables, before you eat anything else at each meal. That's it. 5 to 10 minutes before you eat your main meal, eat a side salad or a bowl of steamed broccoli, or raw carrots and celery, or sautéed spinach, or roasted Brussels sprouts, or a vegetable soup. Any non-starchy vegetable. About 1 to 2 cups. You eat the vegetables first, you wait 5 to 10 minutes, then you eat the rest of your meal normally. This simple change, eating vegetables first, can reduce your post-meal blood sugar spike by 40 to 60% compared to eating the exact same meal with the vegetables mixed in or eaten at the end. Let me explain why this works, because the science is fascinating. When you eat non-starchy vegetables first, several things happen in your digestive system that slow down glucose absorption and blunt the blood sugar spike. First, the fiber in vegetables forms a physical barrier in your stomach and small intestine. When the carbohydrates from the rest of your meal arrive, they have to pass through this mesh of fiber to reach the intestinal wall where they're absorbed. This slows absorption dramatically, causing glucose to enter your bloodstream gradually over hours instead of all at once in a big spike. Second, vegetables stimulate the release of a hormone called GLP-1, glucagon-like peptide 1. You might recognize that name because it's the same hormone that drugs like Ozempic and Wegovy are designed to mimic. GLP-1 slows stomach emptying, meaning food stays in your stomach longer and enters your small intestine more slowly. This naturally extends the time it takes for carbohydrates to be digested and absorbed, flattening the blood sugar curve. Third, vegetables contain compounds that partially inhibit enzymes in your small intestine that break down complex carbohydrates into simple sugars. When these enzymes are partially inhibited, carbohydrates are broken down more slowly, And again, glucose absorption is spread out over time instead of happening all at once. Fourth, eating vegetables first causes your body to secrete insulin earlier, before the big glucose load from the rest of your meal arrives. This early insulin release means your body is prepared to handle the incoming glucose, moving it out of your bloodstream and into cells more efficiently. Fifth, vegetables provide volume and satiation, which means you'll naturally eat slightly less of the higher carbohydrate portions of your meal. Not dramatically less, but enough to make a difference in your blood sugar response. You'll feel satisfied with a smaller portion of rice, pasta, or bread because you've already started filling your stomach with nutrient-dense, low-calorie vegetables. Now let me give you the specific protocol that I teach my patients, the exact steps you need to follow to get the maximum benefit from vegetable preloading. Step 1. Choose your vegetables. The best vegetables for preloading are non-starchy vegetables that are high in fiber and low in calories. This includes leafy greens like lettuce, spinach, arugula, kale, cruciferous vegetables like broccoli, cauliflower, cabbage, Brussels sprouts, other vegetables like cucumbers, celery, bell peppers, tomatoes, zucchini, asparagus, green beans, mushrooms. You want to avoid starchy vegetables for the preload because they contain significant carbohydrates themselves and won't have the same blood sugar blunting effect. So no potatoes, sweet potatoes, corn, peas, or winter squash for the preload. You can eat those as part of your main meal if you want, but they shouldn't be your preload vegetable. Step 2. Prepare your vegetables in a way that you'll actually enjoy eating them. This is critical. If you hate raw vegetables, don't force yourself to eat a salad. Steam them, roast them, sauté them in a small amount of olive oil, make a vegetable soup. Add herbs and spices for flavor. A little bit of healthy fat like olive oil or a small amount of cheese or nuts is fine and actually helps with nutrient absorption. The key is making them palatable enough that you'll stick with this habit long term. Step 3. Portion size matters. You want to eat about 1 to 2 cups of vegetables as your preload. 1 cup is the minimum to get a significant effect. 2 cups is better if you can manage it. More than 2 cups isn't necessary and might make you too full to eat your main meal. Step 4. Timing is crucial. Eat your vegetables, then wait 5 to 10 minutes before eating anything else. This waiting period gives the fiber time to start forming that barrier in your stomach, gives the GLP-1 time to start being released, and gives those enzyme-inhibiting compounds time to start working. If you eat your vegetables and immediately follow with the rest of your meal without waiting, you'll get some benefit but not the maximum benefit. Set a timer on your phone if you need to. Those 5 to 10 minutes make a real difference. Step 5. After you've eaten your vegetables and waited, eat your main meal normally. You don't have to dramatically change what you eat. Obviously, healthier food choices are always better, but the vegetable preload will help blunt your blood sugar spike regardless of what you eat after. You can have your protein, your whole grains, even a moderate portion of refined carbohydrates if that's part of your meal. The vegetables you ate first will significantly reduce the blood sugar impact. Step 6. Do this before every meal, or at minimum before your 2 largest meals of the day. Most people find that lunch and dinner cause the biggest blood sugar spikes, so if you're only going to do vegetable preloading for 2 meals, make it those 2. But ideally, you'd do it before breakfast as well. For breakfast, your vegetable preload might be sautéed vegetables like spinach, mushrooms, and tomatoes, or a small vegetable smoothie, or even leftover roasted vegetables from dinner. Now let me tell you what happened with Thomas after he started vegetable preloading. Remember, Thomas was 71, had been dealing with high post-meal spikes to 250 or higher, and already had signs of diabetic complications, including retinopathy, neuropathy, and heart disease. I taught Thomas and his wife the vegetable preloading protocol. His wife was actually excited about it because she'd been trying to get Thomas to eat more vegetables for years, and now she had a medical reason to insist on it. For the first week, Thomas ate a large salad with mixed greens, cucumbers, and tomatoes dressed with olive oil and vinegar before lunch and dinner every day. He waited 10 minutes, then ate his normal meal. He checked his blood sugar 2 hours after each meal to see what was happening. The results were immediate and dramatic. Before starting vegetable preloading, Thomas's blood sugar 2 hours after lunch was averaging 256. After starting vegetable preloading, his blood sugar 2 hours after lunch dropped to an average of 178. That's a decrease of 78 milligrams per deciliter. Before dinner was spiking to 243, after vegetable preloading it was averaging 168. A decrease of 75 milligrams per deciliter. Thomas couldn't believe that something so simple could make such a dramatic difference. His wife joked that if she'd known vegetables were this powerful, she would have been more insistent years ago. But here's what's important. Thomas didn't change his medications. He didn't dramatically change what he ate at his main meals. He just added vegetables at the beginning and waited a few minutes. That simple change cut his post-meal spikes by about 30% in the first week. Over the next month, Thomas experimented with different vegetables to keep things interesting. Some days he'd have a big salad. Other days he'd have steamed broccoli with a little butter. Sometimes he'd make a quick vegetable soup with whatever vegetables were in his refrigerator. His wife got creative with preparations to keep him from getting bored, and his blood sugar continued to improve. After 2 months of consistent vegetable preloading, Thomas's post-meal blood sugars were consistently staying below 180, and often they were in the 160s. After 3 months, we rechecked his A1C. It had dropped from 7.8 to 7.1%. After 6 months, it was 6.7%. We were able to keep his medication doses the same because the vegetable preloading was doing the work. But more importantly, we stopped the progression of his complications. His next eye exam showed no worsening of his retinopathy. His kidney function stabilized. The numbness in his feet didn't get worse, and he reported that he actually had some return of sensation in his toes. His cardiac function on follow-up testing showed improvement. Thomas is now 3 years into vegetable preloading, and he's doing remarkably well for someone who had advanced complications when we started. His A1C stays in the 6.5 to 6.8 range. His post-meal blood sugars rarely go above 170. He's lost 18 pounds without trying because the vegetables fill him up, and he naturally eats smaller portions of everything else. His wife says he has more energy, better mood, and he's back to doing activities he'd given up. And most importantly, his complications have not progressed. The damage that was happening to his arteries for years has stopped because we eliminated those daily blood sugar spikes that were causing it. Now let me tell you what happened with Dorothy, the retired nurse who caught her post-meal spikes early before complications had developed. Dorothy was even more disciplined about vegetable preloading than Thomas. She did it before all 3 meals, every single day. For breakfast, she would have sautéed spinach and mushrooms before her eggs and whole grain toast. For lunch, a big salad before her sandwich or soup. For dinner, roasted vegetables before her protein and starch. She tracked her blood sugar religiously for the first month. Before vegetable preloading, her post-meal spikes were averaging 215 to 230. After starting vegetable preloading, they dropped to 150 to 165. An average reduction of about 65 milligrams per deciliter, or roughly 30 to 40%. After 3 months, Dorothy's A1C dropped from 7.6 to 6.8%. After 6 months, it was 6.3%, which is considered excellent control. We tested her for early signs of complications at 6 months and at 1 year. No retinopathy, no nephropathy. Normal nerve conduction studies, normal cardiac function. Dorothy had successfully prevented the complications from ever starting by controlling her post-meal spikes early. She's now 4 years into this approach, and she's thriving. Her A1C stays around 6.2 to 6.5%. She's off one of her medications because she simply doesn't need it anymore with her improved blood sugar control. She walks 3 miles every day. She volunteers at the hospital where she used to work. She travels with her husband, and she tells everyone she knows with diabetes about vegetable preloading, because she understands that this simple habit saved her from the devastating future she saw happen to so many patients during her nursing career. If this video has already given you new insight into why controlling post-meal blood sugar spikes is so critical for protecting your arteries, imagine what else you might be learning. Subscribe to this channel because I'm bringing you information that could prevent your next complication. Information about the practical, actionable steps you can take every single day to protect your heart, your eyes, your kidneys, your circulation. This isn't just about one simple step, though that step is powerful. It's about understanding your body, understanding what's happening at the cellular level, and using that knowledge to make informed choices. Every video here is designed to empower you with practical strategies backed by solid science. Hit subscribe, turn on notifications, and let's navigate this journey together. You've already taken the first step by watching this video. Don't stop now. Now let me address some common questions and concerns that patients bring up when I teach them about vegetable preloading. First question: do I have to eat raw vegetables, or can they be cooked? You can absolutely cook your vegetables. In fact, some vegetables are easier to digest when cooked, and cooking can make them more palatable. The fiber that creates the beneficial barrier in your digestive system remains intact whether vegetables are raw or cooked. The compounds that stimulate GLP-1 release and inhibit digestive enzymes are also heat stable. So steam them, roast them, sauté them, grill them, make soup, whatever preparation you prefer. The only preparation to avoid is frying in a lot of oil because that adds excessive calories and fat that can actually slow digestion too much and cause other problems. Second question, what if I don't have time to prepare vegetables before every meal? I understand that time is a constraint for many people. Here are some shortcuts. Keep bags of pre-washed salad greens and pre-cut vegetables in your refrigerator. Opening a bag and putting some lettuce and vegetables in a bowl takes less than 2 minutes. Keep frozen vegetables on hand. You can microwave frozen broccoli or green beans in 3 to 4 minutes. Make a big batch of roasted vegetables on Sunday and keep them in the refrigerator to eat throughout the week. Keep raw vegetables like baby carrots, cherry tomatoes, and cucumber slices cut and ready to grab. Even drinking a vegetable juice, as long as it's low sodium and not loaded with fruit juice, can provide some benefit, though whole vegetables are always better because of the fiber. Third question. I'm on a budget and fresh vegetables are expensive. What can I do? Frozen vegetables are just as effective as fresh, and are often much less expensive. Canned vegetables can work too. Just choose low-sodium options and rinse them before eating to remove excess salt. Buy vegetables that are in season because they're cheaper. Grow some of your own vegetables if you have any outdoor space. Even a small container garden can provide lettuce, tomatoes, peppers, and herbs. And remember, you don't need exotic or expensive vegetables. Simple, inexpensive vegetables like cabbage, carrots, celery, and frozen broccoli work just as well as fancy mixed greens or asparagus. Fourth question. Won't eating all these vegetables cause digestive problems like gas and bloating? For some people, suddenly increasing vegetable intake significantly can cause temporary digestive discomfort. If that happens to you, start slowly. Begin with just a small salad or a half cup of cooked vegetables before one meal per day. Let your digestive system adjust for a week, then increase to 2 meals per day, then 3. Choose vegetables that are easier to digest if you're sensitive, like cooked carrots, zucchini, or green beans, rather than raw, cruciferous vegetables like broccoli and cabbage, which can be harder to digest. Chew your vegetables thoroughly to help with digestion. And know that for most people, any initial digestive discomfort resolves within 2 to 3 weeks as your gut bacteria adjust to the increased fiber intake. Fifth question. I already eat vegetables with my meals. Why do I need to eat them first? This is the key question. The timing matters enormously. When you eat vegetables mixed in with the rest of your meal, they provide some benefit through their fiber and nutrients. But when you eat them first and wait 5 to 10 minutes, you get the additional benefit of creating that physical and chemical barrier in your digestive system before the carbohydrates arrive. Multiple studies have compared eating vegetables mixed into a meal versus eating vegetables first, and the blood sugar blunting effect is significantly greater when vegetables are eaten first. The difference in post-meal blood sugar is typically 30 to 40 milligrams per deciliter between the two approaches. Sixth question, what about fruit? Can I eat fruit first instead of vegetables? Unfortunately, no. Fruit contains significant amounts of natural sugars and will cause its own blood sugar spike. Fruit is healthy and can certainly be part of your diet, but it should be eaten as part of your main meal or as a snack with some protein or fat, not as a preload before meals. The preload needs to be non-starchy vegetables that won't spike your blood sugar themselves. Seventh question, can I just take a fiber supplement instead of eating vegetables? Fiber supplements do provide some benefit and are better than nothing, but they're not as effective as whole vegetables. Vegetables contain not just fiber, but also phytonutrients, vitamins, minerals, and those enzyme-inhibiting compounds that all work together to blunt blood sugar spikes. Studies comparing fiber supplements to vegetable preloading show that vegetables are significantly more effective. If you absolutely cannot eat vegetables before a particular meal, a fiber supplement is a reasonable backup option, but it shouldn't be your primary strategy. Now that you know these optimal strategies for vegetable preloading and answers to common questions, I need you to do something. Comment which vegetable you're going to use for your first vegetable preload and which meal you're going to start with. Use this format, starting with salad before dinner tonight, or trying steamed broccoli before lunch tomorrow, or sautéed spinach before breakfast in the morning. Because when you write it out, when you publicly commit to trying this, you're much more likely to actually do it. And when other people comment their plans, you'll see that you're part of a community of people all implementing this strategy together. So comment now. your vegetable choice, and your starting meal. This isn't just data. This is commitment. This is how we help each other turn information into action. Your comment might inspire someone else to finally take that first step toward protecting their arteries. Let me give you one more important piece of information about vegetable preloading. It works synergistically with other blood sugar control strategies. If you're already exercising, watching your carbohydrate portions, taking medications, all of those things will work even better when combined with vegetable preloading. For example, one study found that patients who combined vegetable preloading with a 15-minute walk after meals had post-meal blood sugar spikes that were 55% lower than baseline, compared to 38% lower with vegetable preloading alone, or 28% lower with the walk alone. The combination was more effective than either strategy by itself. Another study found that vegetable preloading made metformin more effective. Patients taking metformin who also did vegetable preloading had significantly better blood sugar control than patients taking metformin alone, even at the same dose. So vegetable preloading isn't replacing your other diabetes management strategies, it's enhancing them. And here's something else that's important. Vegetable preloading not only protects your arteries by reducing blood sugar spikes, it also provides direct benefits to your cardiovascular system independent of blood sugar. Vegetables are rich in potassium, which helps lower blood pressure. They're rich in antioxidants that directly neutralize the free radicals that damage your arteries. They provide folate and other B vitamins that help reduce homocysteine, an inflammatory compound linked to heart disease. They provide nitrates that your body converts to nitric oxide, that critical molecule I mentioned earlier that keeps your arteries dilated and healthy. So eating more vegetables is protecting your arteries through multiple mechanisms simultaneously, making it one of the most powerful interventions available. Before you go, I want to say thank you for trusting me with your time today. That means something. If you found value here, if you learned something that could protect your arteries and prevent complications, I need you to do 3 things. First, subscribe to this channel. Not because I need the numbers, but because you need this information on a regular basis. There are dozens of strategies like vegetable preloading that can protect your health, strategies that most doctors don't have time to explain in brief office visits. I cover them here, week after week, translating cutting-edge research into practical steps you can take today. Second, hit that notification bell, because YouTube doesn't always show you videos from channels you're subscribed to, and I don't want you to miss content that could literally save your vision, your circulation, your heart, your life. And third, share this video with someone you know who's managing diabetes, especially if they're over 60. Share it with your spouse, your parent, your friend who's been dealing with complications or worried about developing them. This information about vegetable preloading and post-meal blood sugar spikes is too important to keep to yourself. Together, we're building a community of informed, empowered people who refuse to accept that complications are inevitable. I'm here every week with new research, new strategies, and new hope. Subscribe, and I'll see you in the next video, where we'll continue taking control of your health, one informed decision at a time. Let me leave you with this final thought. You cannot change the past. If you've had diabetes for years, if you've already developed some complications, if your arteries have already sustained some damage, you cannot undo that. But you can absolutely control what happens from this moment forward. Every meal is a choice. Every meal is an opportunity either to damage your arteries further with uncontrolled blood sugar spikes, or to protect them with simple strategies like vegetable preloading. The beautiful thing about this approach is that it works immediately. You don't have to wait months to see results. The very first time you eat vegetables before your meal and check your blood sugar 2 hours later, you'll see the difference. And every time you do it, every single meal where you blunt that blood sugar spike, you're preventing arterial damage. You're keeping your endothelium healthy. You're reducing oxidative stress and inflammation. You're protecting your heart, your brain, your eyes, your kidneys, your circulation. One meal at a time, one choice at a time. Over weeks and months, these small choices compound into dramatic improvements in your health and your future. So I want to end with one final comment prompt. Comment one of 3 things. Starting today if you're going to begin vegetable preloading with your very next meal. Starting this week if you need a few days to shop for vegetables and prepare. Or need more info if you still have questions about how to implement this. This simple comment will help me understand where you are in your journey, and it will help other viewers see how many people are taking action right now. Comment now. Starting today, starting this week, or need more info. Thank you for being here. Thank you for caring enough about your health to spend your time learning. And thank you for being willing to make changes that will protect your future. You matter. Your arteries matter. And you have more power to protect them than you ever realized. I'll see you in the next video. And